Hi, Paul. How are you?
Hi, Mark. I'm really good. Nice to see you.
Yeah. Good to see you too. So yeah, the idea of this was just to do a sort of informal chat because we've been doing a lot of these consultations with patients now, and I thought that it'd be good for us to just catch up, just the two of us, and have a chat about our own experiences and share it perhaps with people on YouTube later on, just to let people see what we're talking about here. Yeah, so you've basically given me a whole list here of things that you've found to be problems with guitarists playing, and I've got a whole list of things that I've found as a hand surgeon that are common problems that present in guitarists. So I thought I'd chat about those, and you can talk a little bit about the guitar problems, yeah?
That sounds great.
Yeah, so yeah, as a little introduction, I'll just give my little introduction first. I'm a hand surgeon working in London, specialise in looking after musicians, and I see quite a lot of guitarists, I think it's fair to say. And over lockdown in the last 3 months, I think you and I have done, 6 or 7 sessions with guitarists, and sometimes a hand therapist. And what I've learned is that with an interest in musicians like this, I think my practice under normal circumstances would be about 20 new patients a week. I'd see about 6 or 7 new musicians a week, of whom there'd almost certainly be a guitarist every week. And half of the patients would have the general conditions that everybody else has, like trigger finger, carpal tunnel, ganglions, that sort of thing. And half of them would be instrument specific. And what I've found is that there's a sort of need for this, what I've been calling the Holy Trinity, which is basically you've got to get these elite athletic hands that we're dealing with. You've got to try to get them the same sort of services as you get in sport. So, for example, a top sportsman in tennis would have an elite tennis coach. They'd have an elite tennis physio who would know a lot about tennis, and an elite tennis doctor who would know a lot about tennis. And I think that for far too long now, there's been this massive gap in music where that sort of service isn't provided. And the fourth person you could think about would be a psychologist too. And because you're a psychologist, a teacher of psychology, I think that's ideal. And I've got a very holistic approach, and I know you do too. And these qualities, I think, are really important. And getting these sessions where we come together and discuss these things are really good. I've enjoyed them so far.
So have I. It's been brilliant.
Yeah, it's been really good. So, do you want to just do a little introduction of what you are?
Yes. So I'm a trained professional guitarist, a classical guitarist. I've got a master's in music and a combined degree in music and psychology. And I was studying in Denmark, but also in France with a French guitarist called Roland Jens. And then in England, I took a course as what we call performing arts medicine therapist, and wrote a dissertation on guitar ergonomics, which was published in Classical Guitar Magazine. And I then worked since then with guitarists and guitarist problems and guitar ergonomics.
Okay, I didn't know you'd done that. You've written a book on it, you say?
Yeah, I did a dissertation that was published in Classical Guitar Magazine. Yeah.
Oh, okay. When was that?
This was in the 2004, 5.
Okay. And how long have you been working with BAPAM patients now?
I started in 2004, originally with Dr. Perry.
Yeah, okay. Yeah. And did you work with Ian Winsper as well?
Not so much, mainly from the patient that Dr. Perry saw.
And you worked with Catherine Butler, the hand therapist?
Absolutely,
as well?
Yes.
I spoke to her earlier this week, and she said that she knew you quite well and has some best wishes.
Yes, we've done workshops together for Beckham and so on.
She's published a lot. She's incredibly well read. So we might be able to put some links to some of these things into the talk as well. I'll see if I can work out how to do that, and send a link to Catherine's webpage. And there's lots of resources on there as well.
Yeah.
So yeah, the sort of things that we've been seeing. I mean, probably the commonest thing that we've chatted about is musicians' vocal dystonia, isn't it?
Yes.
Terrible thing, of course, which Catherine is an authority on, and Catherine's written some very lengthy tomes on that. She's got a huge number of patients, got about 150 patients with musicians' vocal dystonia that she's seen over the last 15 years. She's worked with Professor Mark Edwards from George's on that, and done lots of publications, stuff on functional MRI in the brain. It's a fascinating area. What's your experience with vocal dystonia?
Yes, it's not uncommon in guitarists, and it can have a devastating impact on their playing. And I think the thing you need to understand when you're working with these kind of patients is that first of all, it's about reprogramming their brain. And that means from a guitarist point of view, they need to relearn basic string attacks at a very slow pace, with full control, and just one finger at a time on one string.
So yeah, and as I understand it, the mainstays of treatment are slow down techniques. They are splinting and strapping. They are distraction techniques, mirror therapy, things to do with sensory re-education. And it's usually a combined approach, which suggests that none of them on their own is going to do the trick. And it's a really slow process. You're talking a couple of years to get success if you're going to get it at all. And patients have to be incredibly sort of tenacious with the work. But what sort of timelines do you sort of see on patients with focal dystonia and how they recover?
Yeah, I would say that in terms of recovery, the most positive things that I've been involved with those kind of guitarists is that they came back to playing at a certain standard, but not necessarily back to where they were before they had focal dystonia or were diagnosed. And I think it's important to be realistic about that. So I think if you're looking at certainly 1 to 2 years, depending on also how long they've been playing for. If they've been playing for a very, very long time, it takes sometimes longer for them to relearn.
Right. Yeah, and also I think it's, I don't know if there's any science behind this, but the more established it's become, this focal dystonia, once it really gets ingrained, it's more difficult to get them out of that thing because, I mean, you would agree with that?
Yes, I would, absolutely.
Yeah, I mean, the way I see it is it's essentially mainly a software problem. I think it can sometimes be related to a primary physical, mechanical problem in the hand or in the arm or the neck or a nerve entrapment, or maybe there's been some mild muscle weakness for some reason, maybe a nerve palsy, or maybe some triggering finger or some sluggish tendon movement or an injury, which starts it all off. But I think it then becomes a software problem, which is completely insurmountable for them on their own, and they need a lot of help to try to salvage it from there.
Yeah, I would agree with that. And I think one of the problems that we face as guitarists and in the way we practice is that there's a lot of repetition of very difficult technical passages or scales.
Yeah.
Which is not very useful, actually. You should just practice for a couple of minutes on something technical and then take a break.
Yeah.
But some guitar players, will sit for hours doing that. And that's very, very unwise.
Yeah, well, I mean, I think, as I say, I've got a trumpet here. I'm a quite keen musician, as you know, and the whole business of learning scales and riffs and implanting that, what musicians call muscle memory, is a big part of getting fluent, so that you actually have whole strings of software in your brain that run automatically, and you expect them to do that. And I think, as any musician would know, basically, if you start to dissect into the automatic part of what you do, then it tends to go wrong, and that has to be, and I think that's what happens, actually, putting it very crudely with focal dystonia, is that you have a bit of software that you rely on, and then it's gone wrong, and when you try to fix it by conscious thought, it starts doing bizarre things, and I think it's at a very high level of software confusion, and then it needs an awful lot of work to disentangle that.
Yes, I mean, that's exactly what I experienced with the guitarists that I work with on that particular issue. And it is a long journey for them.
It's because these things have been so implanted.
Mm.
Yeah, I mean, there's a whole lot of books and things on focal dystonia, which we can't sort of cover everything in this session, but suffice to say that we see a lot of that. Is there anything else you want to say about focal dystonia? I was going to chat about some other things.
No, I mean, there's just a general point, which maybe we'll come to a little bit later, is about the general way of being with your instrument.
Yeah, indeed. We'll come to that. I was going to work through some of the sort of common things that I've seen in my clinic and that I've felt a need to talk to you about. The interesting thing that happens a lot in the clinic is that a patient will come to me with a problem with their hand. They've never had a problem with their hand before. Their career has been fine. And then all of a sudden there's this calamity. They're finding a point where they're worried they won't be able to perform in public anymore. They can't practice as much as they'd like to do. They've then got a problem. And the solution to that problem might be hand therapy. it might be a bit of surgery or a steroid injection, some simple advice from me, or it might be a bit of advice from you. And it occurs to me quite often that actually consulting you for some technique and education, pedagogy and advice on workarounds, that occurs to me in parallel with these other treatment modes quite often. I think one of the things that many musicians really hesitate about is the thought that they may have to completely redo their technique, or indeed that their technique is in some way at fault and that we would be judging them. And I kind of wanted to reassure musicians that that isn't what we're doing here. We're saying that whatever technique you've had has been working fine for you up to now. You've now got a problem. We now need to look at that and see if there's anything we can do to work around the problem that you've got. Is that how you see it?
Yes, because sometimes actually it's very small changes that needs to be made, but those changes are going to have a great effect, a positive effect on their playing and freedom of movement. And it's in many cases, it's just something that they weren't aware of. And when you point it out to them, you know, you're dropping your head, that creates a certain kind of tension in your body and so on. Once you just correct that, that can make a real big difference to the rest of their playing technique.
Yeah, so I mean, the sort of things I see quite a lot. I mean, the commonest thing that a hand surgeon sees is carpal tunnel syndrome, of course. And on the front of this book here, this is Ian Winspur's book on the subject, of course, that everybody's seen. This is the second edition. On the first edition, there's a very nice picture of somebody playing guitar with their wrist with a high neck position in a nice straight position, and somebody then with the neck a bit lower and it's completely flexed. And of course, that really increases the pressure in the carpal tunnel. And that's just a small little adjustment. That's a nice little example of how you can change something quite simply.
Definitely.
So I mean, yeah, that condition, carpal tunnel syndrome, I'd say is the commonest thing I see in musicians, well, in hand clinics, as well as a trigger finger, and it's just a sensation of numbness in the fingers that we know, but just for anybody watching who doesn't know what carpal tunnel syndrome is, it's just a sensation of numbness that you get in this half of the hand from compression of the median nerve, which comes through this tunnel just here. And if it's flexed, that tunnel's a bit smaller. And if you straighten it out and you wear a splint at night, that often helps. But from there, there's physiotherapy and technique modification, and then steroid injections and surgery, etc. If that doesn't all help. It's a really common condition. And it's largely caused, if the tendons are a bit swollen, they tend to compromise the volume available to the median nerve, because there are 9 tendons sharing that tunnel with the median nerve, 2 to each finger and 1 to the thumb. And if they're a bit swollen, they can also come in conjunction with trigger finger, which is where the fingers just get a bit stiff and they don't slide through the tendon tunnels properly and jam a little bit, and then they catch. And of course, that's a massive problem for anybody who's wanting to perform, because if you're in the middle of a performance and you fear that your finger's going to catch or not move as quickly as you'd like, then not only do you vex about that, but you could actually become quite sort of have massive performance anxiety about something like that.
Yeah, I think that's absolutely correct, because, for example, if you have this issue, and I see it in guitar players, the left hand, so the hand that they're fretting the guitar with, that they're playing with, and the most common thing I see there is that they are pressing too hard in on the fretboard, and the thumb has, for many guitarists, a very active role when actually it should just be a shadow,
right,
that follows the hand. The thumb shouldn't really be involved in holding onto the fretboard. What we are using instead, what we try and teach the guitar players, is to use the muscles in the back, in the shoulder, and the arms to present the fingers on the fretboard, and not the thumb itself. So much less pressure and much more relaxed kind of playing, release whenever it's possible.
Yeah, I mean, it's clearly well beyond my field of expertise as an orthopedic surgeon to advise anybody on playing guitar. I think musicians like the fact that I am a musician, and I can use a lot of general jargon from the music world. And I sit in a little jazz quintet, so I do sit with musicians of different types often enough to just now, because I've been doing this for 3 years. I was a hand surgeon long before that, but I've been looking at musicians carefully for 3 years. I can now scrutinize the kind of differences between players, and I'm starting to use your expertise to look more critically about how people play and the wide range of techniques that are out there and what people do.
Yeah, I think that's another thing, because when we talk about different techniques, what has been important for me is always to remember the individual guitarists. So one hand position for one guitarist may not work for another because that person might be taller or have longer arms or shorter arms and so on. So it's really important to take a really good look at each guitarist, musician, and get a holistic view of what it is actually they're doing and what is it that's technique, what works for them, what would not work.
Yeah. We've written a couple of notes here of the common things that you find that go wrong with guitarists. And the first thing you've written down is guitarists adapt the body to the instrument, not the instrument to the body, which results in poor posture and development of injuries. Yeah.
And that's the first one I always look at, whether I work with somebody who plays electric guitar or acoustic guitar, jazz or classical music, is how are they with the instrument, and they have to adapt the instrument to their body, not the other way around.
Yeah, so in one of these sessions, typically, and I'd give you the background, perhaps send you the letter beforehand, and then have a little chat with you before the session starts about what the problem is and whether there may be any specific workarounds for this particular problem, things to look out for. And then you generally have a little look at them with their instrument, don't you? And you often pick up quite a few things very quickly.
Yes, I think it's always about looking at really carefully at what they're doing. And when I'm working with guitarists, they actually can make tiny movements, which, you know, many people wouldn't notice. But it's obviously those very small movements that makes the big difference to whether they have a successful technique or a poor technique.
Yeah. And what sort of other things do you see commonly then?
Yeah, okay, so that's one thing that's really important. Another thing is, of course, this thing about the primary control that we know from the Alexander technique, the relationship between the head and the neck and the rest of the body, particularly your back. So a common problem is the guitar players drop their head, and they drop their head because they want to look at the fretboard.
Yeah.
But they stick it out so long that it actually causes tension in the shoulders. So I teach them to drop their eyes instead and keep the head as much as possible in a neutral position. You can turn it from one side to the other, fine, but don't drop it down. So that's a really common problem.
Yeah.
I think the other problem is also one thing is that when they practice for too long.
Yeah.
They are not really aware of what goals they have for the practice session.
Yeah.
So they set themselves that this is what I want to achieve. And then they have no way of measuring it. Did I actually achieve that? So it becomes very unconscious the way they are practicing.
Right.
That's, of course, a way of developing bad habits and mistake without even knowing it.
Yeah.
So this whole idea of having short practice, learning from your body feedback, and then reflect over what you are doing, that's really important.
So I part of my history taking, since I started consulting at BAPAM, because the sheet asks me to do this, is to say, you know, how many hours do you practice every day? How many hours do you perform every day? What kind of work are you doing? And musicians vary enormously. Some people will say, I do a lot of practice. Oh, how much is that? Well, 2 hours a day. And some people say, I don't do very much practice at all. I only do about 4 hours a day. So what is too much, and how should people divide up their practice sessions, do you think?
That's a really good question. Again, that's an individual matter, obviously. But for me, the important thing here is how frequently do you take a break?
Yeah.
Because what's the point of practicing if you don't have any awareness of what you're doing? So you could actually practice all day if that's what you want to do, and if you've got time to do it, but you can't do it without having breaks. So from a personal perspective, I would say when I practice a technical aspect in my guitar playing, I just practice for a couple of minutes and then I stop to evaluate what I'm doing.
Right, okay, just a couple of minutes, that's really quite short.
And then I would stop and put the guitar down and think about what I've done, analyze it, then go back. I might do some stretches, you know, stand up or whatever, walk around. If I'm practicing a piece of music that I know and that I can play, then it could obviously be for a longer time. But I rarely have a practice session that is much longer than max 20 to 30 minutes, and that's the maximum. They're often much shorter.
That's very interesting. I mean, I don't know how much problems are, you know, I don't see people with ergonometric problems with trumpet playing for some reason, and I suppose my spinal colleagues might see a bit more of that sort of thing. But if I'm practicing at home and and I want to transcribe a solo or something, I'll be 20 minutes into listening to this guy playing a solo and then trying to play it. And the time passes so quickly. You go 20 minutes have gone no time. And actually, as you get more and more intense with it, you get less and less ergonomic in the way you're sitting. You get hunched up and tense. And of course, you're getting anxious because you're not getting it right. Yeah, it gets much worse. And you can go for longer than that. You can go half an hour, 45 minutes. And I imagine a lot of people do that.
Yes. And I can only look at my own practice when I was younger. I would practice maybe 7-8 hours in a day.
Yeah.
And sometimes I would play scales non-stop 1 hour.
Right.
And the truth is that it was a complete waste of time.
Yeah.
Because I wasn't learning, because I wasn't actually aware of what I was doing. And
the measures that you've talked to me about before, what is your evidence that they're effective? Where have you gained them from, and how do you know that they work?
So the first person I know it from is myself, because I had to change my playing technique. So I've been through all these things that I worked with the guitar players. So they have made a tremendous difference in my own playing. But the other feedback I get is from the guitar players who come and see me.
Right.
And when I then, check in with them later on and see how they're doing, they can tell me about the progress that they made. But they can also tell me about the things that we went through that didn't work for them. And then we discuss, well, what could be another way maybe you could solve this problem?
Yeah. And then of course you follow it up and find out whether it's effective or not. Just like we do, and therapists do it, and hand surgeons do that. And because they're biological systems, of course, the first intervention may not work straight away for various reasons. One is that the patient isn't compliant enough. One is that the diagnosis is wrong. Perhaps we need to think about it more, maybe more complex than we first understood. And often a sort of method of trial and error needs to be done, and you need to be patient and work through it.
Yes, absolutely. The thing that I always do with guitarists when they come and see me first is I always ask them, we always have a chat about the problem and the discussion we've had beforehand and so on. But then I just ask them to play. Yeah. It could be a scale or a piece of music, whatever they feel comfortable with. And I spend a lot of time just observing them. And in that process, I'm thinking, what might be the right solution for them? Because it might not be the same for a guitarist I saw yesterday.
So you see guitarists of all different styles, don't you, and all different levels? Is that right?
Right from the self-taught young guitarist to the seasoned professional session musician and professional classical guitarist. With the bass guitarist, we often see this with the right hand, coming down like that.
Yeah.
Which for some players obviously work, and for others it doesn't. I think in general, when I work with bass guitarists, I really try and make sure that the instrument has the right angle, because the lower the neck is pointing towards the floor, so to speak, the worse it is, because the further they have to reach. So I would take it off. And then what I try to do with them is I actually try to show them some of the techniques that we use on classical guitar. Right. And there was a very famous double bass player called Niels Henning Ørsted Pedersen, who was world famous in jazz music. He used to play with Oscar Peterson. He was actually a Danish bass player, and he used in his pocket fingers classical guitar technique.
Right.
So he played with all three fingers, for example, instead of just.
Presumably, very few bass players have gone through classical pedagogy in terms of how they should and shouldn't play.
Yeah, and that's something you hopefully have to take into account when you're working with them and see what is acceptable to them.
Yeah, I see. And so you've got this little list here. There's a whole load of other stuff about warm up and cool down, stretching, and do you find those essential? And any particular advice on warm ups and cool downs?
Yes, I think that's really important in general to have good fitness, because it's obviously hard work being a musician because you're using your body all the time. So what I do is I have a special routine that I go through with various stretching exercises.
Yeah,
some of those I'm taking actually from the New York City Ballet and other places that I use. And what I find beneficial about them before and after and during playing is that it makes my body relax, and it also strengthens my body, and it makes me undo the things I do on the guitar, by stretching out fingers and arms and so on. So I find it's a great sense of relief doing those kind of exercises.
Oh. Yeah, the guitar really is a problem. As I was saying, it is the commonest thing that commonest instrument that I think I see in clinic with medical problems related to the hand and the arm. And you're a big fan of Alexander technique as well, aren't you?
Yes, I mean, for me, that was a huge discovery. When I came to England, you know, I had lessons with an Alexander teacher. And what was beneficial to me was we just didn't learn how to do the various things that you do normally with an Alexander teacher and stuff. But after the second lesson I had with her, I brought my guitar. So I would work with the Alexander technique applied to the guitar. And that was hugely beneficial.
Right. Yeah. Yeah. And what are you? You're also a psychology teacher, is that right? And
Yes.
and so psychology is a big part of performance as well, isn't it?
Yeah, I think it is, Mark. I think, you know, what you think about yourself is incredibly important as a musician. And particularly when you are suffering from stage anxiety, you know, performance anxiety, or if you have a medical issue like the ones you've been talking about, the anxiety that generates.
Yeah.
So I think I always have a chat with the guitarist about themselves. Basically, how are they feeling? How are they thinking about themselves?
Yeah.
What are they happy about, proud about? What are they worried about? And how realistic is that? And I think that has been something that I've really learned over the years, that if you're going to be a successful musician, you know, you've got to have your ambitions and the drive and the things you want to do, but they've got to be realistic.
Yeah, yeah, yeah.
And that's something we talk about. And I think, for example, going back to talking about focal dystonia, I think that's really important that the guitar player, the patient, has a realistic understanding of how long it would take to recover and so on.
Yeah, the goals are achievable and have a timeline, all of that stuff. Yeah, yeah. Yeah, it's much the same in any profession, really, isn't it? I mean, in my job, when I do my annual appraisal, then my appraiser would often ask me, you know, what are you hoping to achieve? Is it achievable? Is it on a reasonable timeline? And what are you going to do to get there? Yeah. And then you say there's a whole load of things as well. There's quite a few extra things there about general things, but you've also talked a bit about classical guitar, the right hand, the left hand, electric guitars, and some common pitfalls.
Yeah, I think the kind of guitar style that I've developed, if we start with classical guitar first, is, and this was something that I learned not initially when I was learning to play the guitar, but later on, and that was if you use a footstool, basically to balance the guitar between your legs. Yeah. The guitar touches the right side of the body, and there's space on the left side of the body between the instrument and yourselves, and not to hold the guitar with your arms. And that frees up your body to, and your hands in particular, to move around on the instrument. So I think that's really, really important.
So I see guitarists who balance the guitar sometimes on the left knee and the right knee. I don't know what's the right way, which way you should do it.
No, I don't think that's necessarily a right or wrong way, but you've got to find what works for you.
Yeah, okay.
And you know that sometimes I'm playing with my guitar, just holding it on my legs with my both legs planted on the ground, and then the right arm is balancing the guitar. And I'm just playing it like that, holding it up in the air. So there are lots of ways, and again, you've got to find out what works for the different guitarists. I think that's really, really important. And then, you know, with the left hand, I talked about that the hand, the arm, and the wrist, and the shoulder and the back should work as a single unit.
Yeah.
That the thumb is just a shadow, you know, that follows that without putting any specific pressure. And actually, what's really important for both hands is what I call partial relaxation. And that means when you stop using a finger on the fretboard or a finger in your right hand plucking a string, they need to come back to a neutral position and relax.
Right.
So that you're not in tension all the time.
Yeah, I've seen you work through that with one of our patients, and that was really interesting to see how the finger goes into spasm, and then or it just goes into a flexed position, and then they don't relax at the end of that. That's interesting.
Exactly. And that's one reason, for example, on classical guitar technique on the right hand, that I don't use the rest stroke. I never rest on the neighboring string. I always use the free stroke, because it allows the finger, once it's attacked string, to go back into neutral position, and then ready to attack again. And I found that really, really helpful to do that. And I think on the electric guitar, a lot of the similar things, what's important here, some of the things I see really common, which are not helpful, is right hand, the plucking hand on the electric guitar, where the little finger touches the body of the guitar. And I know we had a patient who had that problem.
Yeah.
And then the hand is very stiff because it can't move, or that the hand is pressed down with the wrist onto the guitar body and then stuck as a point of contact.
Right. Yeah.
And that creates a lot of tension and pain in the right hand, the plucking hand. And that's really common, sadly, to see.
Yes, and probably people get away with doing that for a very long period of time. I mean, you see people in sport and also things with strange techniques, and they get away with it. But then there comes a point where, you know, for this particular individual, this seems to be something that isn't working for them, and actually trying to find a way around that would probably be a way out of their pain.
Yeah, I think that's true. And the earlier you catch that, the better it is.
Yeah, I mean, in a lot of sport, people, the physios talk a lot about the kinetic chain, which is basically when you're looking at delivering more stroke and more power in the wrist. When you're a tennis player and you're striking, they basically look at everything from the way that the foot is planted to the position of the hip, through to the spine, posture, shoulder, and it's only that then delivers that power to the hand. And so you have to think not just about this part, and you can obsess about this part perhaps because that's maybe where your pain is or where you feel your shortcomings are, and it's very easy not to think about the whole chain all the way down, isn't it? Yeah.
I totally agree. You know, you need to have a holistic approach to playing and practicing, and you can't. Of course, there are some things where on the guitar we would look at, you know, what are you doing with your third finger, you know, to get X, Y, Z and stuff like that. But it mustn't be the overriding way of learning. You have to do exactly what you're saying. It is the whole body that takes part.
And one of the best things I've seen happen is that basically when musicians start to realize that this holistic approach to the way they play and rethinking the way they play, they might find that some of these things contribute to the quality of the sound that they're producing, and actually that it may be better when they work through it systematically from the ground up.
Yeah, I mean, the end goal, I think, for any musician is to have a sound that they are really happy with and proud of, and maybe is recognizable to them.
Yeah, and that's a win-win then, isn't it? If they can do both of those things, they can reduce their pain, feel more comfortable, more relaxed, and that'll often come across in the way that they sound. Yeah.
Absolutely, absolutely.
Yeah. Always tell, can't you, when you watch a musician playing, if they look a bit tense. Makes a big difference if somebody looks just relaxed and the music's just flowing.
Yes, and I think actually sometimes, Mark, you notice it even before they start playing, just the way they walk onto the stage.
Yeah.
Because that's where the communication with the audience starts. It actually starts, you know, even before you play your first note or song your first note, whatever it is. It's how you come onto the stage.
Yeah, that's important. Yeah, what else have you got down here? You talk about the thumb over the guitar neck, electric guitarists. That's a common one, isn't it? Putting the thumb.
Yes, it is. Where you know where they put the thumb over the guitar neck. I mean, you saw Jimi Hendrix do that a lot. Yeah. Now, if it works for a person and it doesn't cause any pain, then you know that's absolutely fine. But if it does cause pain and you have this as a technique, then you need to realize that the thumb needs to be somewhere behind the neck, not necessarily hidden in any way, because that depends on the length of your thumb, obviously, but that you should be careful about having it as an active role, because you're grabbing the guitar and bending your wrist quite often. So if you do that all the time, that could cause a lot of pain in your left hand. So you've got to be careful about that.
Yeah, and of course sometimes there's a huge difference in the extended wrist position with the thumb over the top and the flex wrist position like that. And so some conditions, I suppose, might be made easier or in fact, people might have found that already as a workaround. If they were tending to get carpal tunnel syndrome from using bar chords, they may actually just use the thumb over the top to try to reduce that. And there may be other ways that you and I and the hand therapist can work together to sort of come to an ideal solution for that sort of problem.
Yeah. One thing, I mean, just to pick up an example of that, because there is, of course, a time on the electric guitar where we do use the thumb a lot, and that is when we are bending strings.
Oh, okay.
So bending strings is very common on the electric guitar. You bend up to the next note, and you use the thumb to come up, you know, on the neck to do that. And what I then always suggest to the guitarist is, once you've done that, cancel that movement and let the hand come back, you know, to the natural position.
Yeah.
You get a natural flow of movement from some real tension when you're bending the strings, and then you come back to a more relaxed position afterwards, and that's okay.
Yeah. Gosh, we've covered quite a lot. I mean, I'm conscious of the fact that this is coming up to sort of 40 minutes now, and that probably be about as much as anybody could possibly bear to watch of this. But what I was going to suggest is, because these are great, and there's so much more we could discuss in detail about each one of these conditions that we've mentioned, and there are so many others as well. I've got written down here, digital neuroma, where people get hypersensitivity in the tips of the fingers. There's so many other conditions, extensive tendinitis. And then people who've got other problems. They've had a fracture, they've now all got a deformity, and they now have to find a new way of playing their instrument. And there's a lot more of these little blogs we could do, perhaps make them a little bit shorter in the future, and we could add them on as bolt-ons for people to take as a sort of modular thing if they wanted to follow something that particularly interested them.
I think that's a great idea.
Yeah, we should do some more, yeah?
Yeah.
It's fun chatting to you anyway.
It's always great to chat with you, Mark. Thank you so much.
Okay, so we'll leave this one there now, and then we'll do some more, okay?
That sounds great.